welcome. Today, we're diving into a crucial topic that affects many of our loved ones as they age. Heart disease is one of the leading health concerns for the elderly, and recognizing the warning signs early can make all the difference. In this video, we'll discuss 5 warning signs of heart disease in the elderly that should not be ignored. Whether it's your parents, grandparents, or friends, understanding these symptoms can help you take proactive steps toward better heart health. Let's get started. Number 1. Shortness of breath. Shortness of breath, or what is medically known as dyspnea, is a condition in which a person feels difficulty breathing or feels like they are not getting enough air. This can occur during physical activity, such as brisk walking or climbing stairs, but it can also appear while at rest. In older adults, shortness of breath is often a sign that the heart is not pumping blood efficiently. When the heart experiences problems such as blocked arteries or weakened heart muscles, oxygen-rich blood may not circulate properly throughout the body. As a result, the organs and tissues begin to lack the oxygen they need to function optimally. When this happens, the brain and nervous system respond by signaling the body that something is wrong, leading to the sensation of breathlessness. It's important to note that shortness of breath is not merely an inconvenience. It can be a serious indicator of an underlying health condition. For instance, if someone experiences shortness of breath along with other symptoms, such as chest pain or dizziness, it could be a sign of an ongoing heart attack. For older adults who may already have a history of heart disease or other risk factors, such as diabetes or hypertension, it is essential to pay attention to even small changes in their breathing patterns. If they begin to complain of breathing difficulties more often than usual, or if you notice them gasping for air after light activity, this is a clear sign that it's time to consult a doctor. By monitoring and paying close attention to these symptoms, we can help ensure that our loved ones receive the proper medical care before the situation becomes more serious. So always remember, when it comes to the heart and lung health of our elderly, never hesitate to seek professional help. Number 2. Chest pain or discomfort. Chest pain is a symptom that often becomes a primary concern when discussing heart health. It can present in various forms, such as pressure, sharp pain, or a burning sensation in the chest area. In older adults, chest pain can be a signal that something is wrong with the heart and requires immediate attention. When someone experiences chest pain, it's important to understand that it can be caused by several factors. One of the most common heart-related causes is angina pectoris, a condition where the heart muscle doesn't receive enough oxygen due to a blockage in the coronary arteries. When these arteries become narrowed from plaque buildup, composed of fat and cholesterol, blood flow to the heart muscle is restricted. As a result, the body feels discomfort or pain in the chest. This pain may feel different for each individual. Some describe it as a heavy pressure or fullness in the center of the chest, while others may feel pain radiating to the left arm, back, neck, or even jaw. These symptoms are often triggered by physical activity or emotional stress and may subside with rest. However, it's important to note that not all chest pain is directly related to heart problems. Other conditions such as digestive issues like acid reflux, lung problems like pneumonia, or even anxiety can also cause similar sensations. Nonetheless, for older adults with a history of cardiovascular disease or other risk factors, like hypertension and diabetes mellitus, any episode of chest pain should be taken seriously. If an elderly person complains of chest discomfort, especially if it's accompanied by other symptoms, such as prolonged shortness of breath or cold sweats, it is a medical emergency that requires immediate attention from a healthcare professional. Prompt treatment is crucial to prevent further complications such as a heart attack. With a deeper understanding of this symptom and increased awareness of changes in their daily health, we can help protect our loved ones from serious potential risks related to their heart health. Number 3, fatigue. Fatigue or excessive tiredness is a symptom that is often overlooked, but it can be an important indicator of underlying health issues, including heart disease. In older adults, fatigue is not just about feeling tired after physical activity. It can mean feeling drained even after adequate rest or light activity. When the heart isn't functioning properly, such as due to damage to the heart muscle or blocked arteries, the body's ability to pump blood and oxygen to all organs and tissues is impaired. As a result, the brain and muscles may not receive enough oxygen to perform optimally. This can lead to prolonged fatigue and a lack of energy for daily activities. For many older individuals, this fatigue may develop gradually. They may begin to notice that they can no longer perform everyday tasks as they used to, like walking around the house or even standing for long periods without feeling extremely tired. In some cases, they may also struggle to sleep well due to physical discomfort or anxiety about their health. Additionally, fatigue may be accompanied by other symptoms, such as shortness of breath during light activity or an increased heart rate. If an elderly person complains of persistent tiredness without a clear reason, especially when combined with changes in sleep patterns or appetite, it is a signal that something more serious might be occurring. It's important to note that while fatigue can be caused by various factors such as depression, anemia, or infection, in individuals with a history of cardiovascular disease or other risk factors like diabetes, this condition should be taken seriously. Ignoring these signs can lead to serious complications if the underlying health issue is not addressed in time. Therefore, if you notice signs of excessive fatigue in your elderly loved ones, especially if it lasts for several weeks, it is crucial to consult a doctor for a thorough evaluation of their health condition. With timely medical attention and care, we can help maintain their quality of life and prevent potential serious issues in the future. Number 4. Swelling in legs and feet. Swelling, or what is medically known as edema, is a condition where fluid accumulates in body tissues, often visibly in areas like the feet and ankles. In elderly individuals, this swelling can be a signal of circulatory issues or heart function problems. When the heart cannot pump blood efficiently, pressure in the blood vessels can increase, causing fluid to leak into surrounding tissues. One common cause of such swelling is congestive heart failure. In this condition, the heart is unable to pump enough blood to meet the body's needs. As a result, blood returning to the veins can become backed up, leading to fluid buildup, especially in the lower parts of the body like the feet and ankles, due to gravity pulling the fluid downward when a person stands or sits for long periods. This swelling may be accompanied by other symptoms, such as a feeling of heaviness or discomfort in the swollen area. Some people also report difficulty wearing shoes due to changes in foot size caused by fluid accumulation. If the swelling persists or worsens over time, it could be a sign of a serious issue that needs attention. However, it's important to note that not all swelling is directly related to heart disease. Other factors like kidney problems, which can also cause fluid retention, local infections, such as cellulitis, or even side effects from certain medications may contribute to edema. For elderly individuals experiencing leg swelling, especially if it's accompanied by symptoms like shortness of breath or chest pain, it's crucial to seek medical help. Doctors will conduct a thorough evaluation to determine the exact cause of the edema and develop an appropriate treatment plan. By monitoring physical changes like this and maintaining open communication about their daily health, we can help ensure our loved ones receive the right medical attention before the situation becomes more serious. So always remember, when you notice unusual signs like swelling in their limbs, don't hesitate to take action for their best health and peace of mind. Number 5. Irregular heartbeat. An irregular heartbeat, medically known as arrhythmia, is a condition where a person's heart rhythm becomes abnormal. This can mean the heartbeat is too fast, tachycardia, too slow, bradycardia, or beating with an irregular pattern. In elderly individuals, arrhythmia can be a sign of a serious heart condition. that requires careful attention. One common cause of arrhythmia is a disturbance in the heart's electrical system, which is responsible for regulating the heartbeat rhythm. When these electrical signals are disrupted, such as due to heart muscle damage from a previous heart attack, coronary artery disease, or high blood pressure, the heartbeat can become erratic. This may lead to symptoms like palpitations, a fluttering or pounding sensation in the chest, dizziness, shortness of breath, or even fainting in more severe cases. For many elderly individuals, feeling abnormal heartbeats can be distressing and worrisome. They may describe the sensation as their heart skipping a beat or fluttering. If arrhythmia occurs occasionally and briefly without any accompanying symptoms, it may not be a major concern. However, if it persists or is accompanied by symptoms such as chest pain or shortness of breath, it could indicate a medical emergency. It's important to note that several risk factors can increase the likelihood of arrhythmia in older adults. For example, a history of cardiovascular disease, the use of certain medications, such as those for high blood pressure, and lifestyle habits like excessive alcohol consumption or smoking can also affect heart rhythm health. If an elderly person reports feeling irregular heartbeats, especially when accompanied by other symptoms, it is crucial to seek medical help immediately. A doctor will perform a physical examination, along with additional tests such as an electrocardiogram, ECG, to diagnose the type of arrhythmia and determine the best treatment approach. Thank you for joining us today. To learn about these important warning signs of heart disease in the elderly, remember, being aware and informed is key to prevention and early intervention. If you notice any of these symptoms in yourself or a loved one, don't hesitate to seek medical advice. Your heart health matters. If you found this information helpful, please like this video and subscribe for more insights on maintaining a healthy lifestyle as we age. Stay safe and take care.